Hi, this is Rockey, and I want to take a few minutes to talk about something that's really important to us here in our dental office. We have an oral systemic practice here, is what I refer to, and one of the main things we want to look for and help patients with is something that's commonly called sleep apnea. Now, I refer to it more as breathing disordered sleep. The real issue with sleep apnea is it's really not a sleeping issue, it's really a breathing issue that helps interfere with your sleeping. So in any case, if we have a breathing issue where oxygen needs to go in and out of our lungs to help supply our organs, and we have any interruption of that, of course, that's quite serious. And as I'll show in just a few minutes, that does affect your health. It can be from mild to moderate and even severe. And if it is severe, in my book, it can even be life-threatening. So the goal for us here in our dental practice as an oral systemic practice is to help educate patients in really what's going on here and possibly help screen them and move them through the process of getting a diagnosis and in theory treatment. So at this point, we're referring to sleep apnea as asphyxia, inability for oxygen to get in and out. In fact, the Greek word apnea relates to want of breath. So that's really the root word apnea. That's really the root of it there. Sleep apnea, of course, would be asphyxia during sleep, so we have some sort of depressed breathing issue while we're sleeping. And then obstructive sleep apnea, of course, is nighttime asphyxia caused by some obstruction, and that's usually soft tissues in the back of the upper airway, either soft palate or the tongue usually is the issue that closes off the trachea in the back there, not allowing for smooth airflow rhythmically, which goes into our lung and then oxygenates our blood. We also have two other kinds of sleep apnea. That would be central and be mixed. These are much rare and don't necessarily deal with that in the dental office. So we're really talking about here is obstructive sleep apnea is some sort of obstruction causing lack of breathing at night and interrupting our sleep. And a pictorial of that is normal breathing here would be our tongue and our soft tissues here, and air coming in through our nose in theory and air coming in through our mouth if our mouth is open, and blending and mixing, and we have a smooth transition and airflow going down and into the lungs and help oxygenating our blood. With obstructive sleep apnea, really what we're talking about is the soft tissues, either the soft palate or the tongue, usually is the case, flopping back, closing the airway here, and we do not have a smooth transition or smooth oxygen transfer in and out here rhythmically at night. And as you can see, that would lead to lack of oxygen in the blood and our organs suffering from that. It's usually a cycle. Starts off with sleep apnea, sleep onset, we have that airway closure, we have the, by definition, apnea, we end up with a reduced oxygenation, and then our brain senses that reduced oxygenation in the blood, triggers ventilation, triggers breathing, which then in a struggle to wake us up so that we start breathing again, we have some sort of arousal that typically opens the airway. Then we end up breathing again, usually at an accelerated rate along with an accelerated heart rate to try and get blood values back to normal. Then once that happens, then we go back to sleep, and the cycle can go on endlessly at night from a few times to many, and that's the issue. Significant signs for us here that we can visualize as a dentist looking at our patients and helping educate and screen them would be snoring. And of course, that usually is a bed partner that is recognizing the snoring. That has driven patients to me. But first thing I want to educate them is that snoring and the sound really isn't the issue. That may be signs, and usually is signs that something other quite significant is going on, and that's really what we want to address. And what that can lead to is another big screening factor here is daytime sleepiness or daytime drowsiness. And we actually have a scale, Epworth Sleepiness Scale, which we can actually give you that test and you can find out where you are on this. Obviously people that drive for a living and people that need to be concentrating, having some sort of drowsiness is obviously going to affect their lives. A big component of this that we see is high blood pressure. If your heart is having to work triple overtime at night to try and arouse you, to try and pump blood, to try and get your oxygen back to appropriate levels, we know that your heart is going to suffer from that and you're going to end up with high blood pressure. This is very common. Reflux is another issue. You can see quite a diabetes here too, but this is a big deal here that most patients don't realize. When you're being aroused, possibly violently at night to try and breathe again, that tends to want to push gastric juices back up into the esophageal area, and that's where the reflux comes from. So if you're sleeping normally and breathing perfectly, and there's no need for dramatic arousal, then you don't end up with this. But this is a big thing that patients are generally not aware of. But when I mention it to them and it comes out in screening, then they put 2 and 2 together. Diabetes is another issue here too. Many signs that we can, as first responders here, as dentists or first responders, maybe in helping to diagnose and screen this, is we see heavy wear on teeth. We can see a scalloped tongue and large tongue and different things. Contributing factors: obesity. We look at BMI, body mass index. Neck circumference is a big deal here. Age and breathing history and family history. So this is what we can look at. We can add through questionnaires and screen. We can find this information out from the patient. We can find this information out. We do a clinical exam, dental exam. We can see this here, and through history, so we can view this material too. So we can get a pretty comprehensive picture and get an idea as a dentist of whether the patient should be screened or should be pointed in the direction of looking to see whether they have signs of obstructive sleep apnea. What I said at the beginning, I think, is most important. Sleep apnea really just isn't a snoring thing or isn't a struggling to sleep at night or a drowsiness issue. The real effects are far-reaching and are systemic. And so I just have this list here of medical issues that are directly related to sleep apnea. So a bunch of them here are heart. So I mentioned hypertension prior to this. We now can see that it can get into drug-resistant hypertension, heart failure, AFib, atrial fibrillation is another big deal in that area. Stroke, no one wants that. Any kind of brain deterioration or inflammatory brain issues, Alzheimer's or dementia, anything like that. Diabetes, metabolic syndrome, that's all related right in here. So you can see there's a significant outreach or effects, far-reaching effects in medical aspects of a patient's health that apnea can affect. So that's why, in my mind, it's very important that we screen for this and help patients get going in the direction of getting screened and diagnosed. One component that parents need to know is that we're seeing more and more of concentration issues, ADD, and behavioral issues in kids today. It seems I hear reports almost daily regarding that from parents and their kids. One area that is seemingly ignored but tends to be very important, and I've seen some pretty dramatic turnarounds, look for obstructive sleep apnea in kids. And if there is testing positive for this, they're mouth breathers and they really have difficulty breathing during the day and they have more difficulty breathing at night, that leads to lower oxygenation levels for the brain, and we see issues like this significantly. So keep in mind, parents, that if there's any of this particular things going on, you may want to look also at an apnea component in the child. All right, that's basically why we as dentists want to look at this, why it's important that we educate our patients, make them aware of what may be going on, help them getting going in the direction of being screened and diagnosed. And the way we do that is Screen Official. Fortunately, we have more patients that do not have apnea than do, but in any case, it's important, I think, as a dentist, as a frontline responder, to help screen and diagnose for this. So in the next video, I will talk about how we do that.